Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to answer the question of how do you know when it's time and appropriate to be discharged from physical therapy after your knee replacement surgery. Everyone, so today we're talking about when do we know, or when do you know that it's time for you to be discharged from physical therapy after your knee replacement surgery? So when is it time? When is it appropriate for you to stop going to therapy? When is it time to just manage it on your own or take another route and stop going to physical therapy? This is a really common question I get a lot. And to tell you, the short answer is really it's going to depend on you as an individual. It's going to depend on all sorts of different characteristics of yourself, of the goals that you want to achieve, of how your function was before surgery and after surgery, your pain levels. All sorts of things are going to play a part into making that final determination. But let's kind of look a little bit at helping to look at some factors and things that as a physical therapist I would look at for a patient who is asking this same question. So mainly we look at how you're doing with your rehab. So here are just a couple different things that I like to look at and kind of check off, or at least most of them get checked off before I say, okay, it's safe and appropriate and sounds good that you can stop going to physical therapy. So the first one is being able to walk and also go up and down the stairs without an assistive device, ideally, so without a walker, without a cane or crutches, and having minimal pain and relatively few impairments in your walking. So, if you're walking with a really bad gait pattern and really painful when you walk and it's just really intolerable and you're really limping or it really looks bad, this is a sign that you might still need some therapy services. It's normal to have a little bit of, not everyone is going to walk exactly perfectly the same. It's also normal to have a little bit of pain and discomfort with walking to an extent, and especially with stairs that might be increased a little bit more. But we want to have it at least at this level where it's manageable, where if you didn't use a walker or cane before surgery, you aren't using one now. Sometimes people use an assistive device before surgery, and maybe it would be appropriate to keep using that after surgery. But for most people, we want to get them off of the assistive devices and walking with a relatively normal gait pattern and relatively little pain, if none at all, would be awesome too. So that's goal number one. Another thing we look at is your strength as well as your range of motion. So for your strength, we're looking at all the muscles throughout your legs. So we're looking at your quadriceps, your thigh muscles, your hamstrings, your calf muscles. We're looking at your hip muscles, your glutes, of course, are the big one there. And hopefully, and trying to get the strength in the leg that you had surgery on to very close, if not even and equal to the opposite leg that you didn't have surgery on. Very big thing and very big problem that happens after surgery is there's a lot of muscle weakness, there's a lot of atrophy going on. So we really want to work in therapy to really build that strength back up so it's very close, if not equal, to the other leg. And in that case, that's going to be very important for your function, for your ability to get around, for the longevity of the knee replacement, all sorts of things that are very important and benefited by having that muscle strength. And then for the range of motion, this is obviously a big topic of discussion as well. People talk about, what range of motion do I have to achieve? For myself, it tends to be from 0, we want to get you at least to 0, so completely straight, to about 115 degrees of bend or knee flexion. Now that's at a minimum. Hopefully a lot of people will get more than that, get up into the 20s maybe, or even more some people, but at least getting to 115 degrees. Very rare instances someone might have a little less than that for whatever reason. Some people just, their bodies make so much scar tissue and they have just so much stiffness that, they might not be able to achieve that goal. but our goal on the onset of therapy and after surgery is definitely at least to get to that 115 degrees, if not a little bit more. What else we look at is your pain levels. So it's very common and very normal to still have pain after you're done with therapy. Still probably have some pain you're dealing with, swelling, stiffness. These things are still normal, but at least we want to help get to that level where it's manageable, where it's tolerable. You might have these episodes of really significant pain and stiffness and swelling different times, but at least it's starting to decrease in intensity. It's starting to decrease in how frequently you're having this pain and discomfort. Those are things we're looking at as well. And then we also want to just look at, are you set up to be able to manage your knee replacement once you're done with physical therapy and once you're on your own or going a different route? So do you have an exercise program? Do you have some sort of plan to stay active if that's something that you're doing with a trainer or going to a gym or something you're doing on your own, whatever that may be? Are you effectively managing your pain, if that's taking different pain medicines, if that's icing, elevation, things like that? Do you know how to manage that effectively and appropriately by yourself? Are you basically able to be independent in taking care of your knee effectively without a physical therapist there helping you all the time? And then we also look at your function. So, what was your function like before surgery? And are you at that point, or can you progress to that point with the exercises, with staying active and everything like that? So are you are we directed you, and have you been directed onto the right track where you can get there by yourself without therapy services? And this is going to be different for everyone. So, some people, they just want to be able to go through their daily activities, be able to walk with minimal pain and discomfort. Some people have much more physically demanding goals, such as maybe doing CrossFit or running or something like that even. So those people might need a little bit more therapy, a little more intense exercise programming, whatever it may be, to get to that more physically demanding goal. So that's something we look at as well. Now, at the end of the day, we also have to take into consideration insurance coverage, of course. So, something very important is probably before surgery you should, or at least before you start your outpatient therapy after surgery, really take a good look at what your insurance covers in terms of therapy. How many visits does it cover? What does it cover? What do you have to pay out of pocket? And this is going to give you a good idea, and you can share this information and discuss this information with your physical therapist to better make a plan where you don't get to a point, maybe 8 weeks, maybe 12 weeks out from surgery, and all of a sudden you're cut off, your physical therapy isn't covered anymore by your insurance, and you're lost and you don't know what to do and how to go from there. If they know ahead of time that that's the plan, is you're going to have this much therapy coverage, a good therapist and a good patient and someone, you're going to make that plan as you go along, so that once you get to that time where your insurance coverage stops, you have a plan to be able to manage things and take care of it effectively by yourself. So that's something to really keep on top of and keep watch of as well. But at the end of the day, all these things considered, there's no specific time frame. Some people, they can accomplish this in 4 weeks or 6 weeks. Some people maybe 8 or 12 weeks. Some people much, much longer. And honestly, I've seen all different time frames and everything in between, and it's perfectly normal. It's perfectly all right. Our bodies heal differently. Our bodies respond to trauma and pain differently. We have different lifestyles and different things, different goals we want to accomplish, different expectations from surgery. And so taking different amounts of time is perfectly normal and perfectly okay. Don't necessarily look at the time frame, but more so look at are we making progress towards these goals that I noted? Are we making progress towards something that you want to achieve and accomplish? And if we are, then it might be good to keep doing physical therapy. If you need that help and might not be able to do it independently by yourself yet. So that's the overall things that we look for when it determining if someone is appropriate to be discharged, appropriate to stop going to physical therapy. But of course, it's going to be a discussion with your therapist, discussion with your surgeon, and it's going to be individualized and customized to you as an individual, your circumstances, your goals, and your needs. So really, it comes down to those three things: your goals, your circumstances, and your needs. So thank you very much for watching, everyone. As always, be sure to comment any questions you might have or commentary. I'd love to hear it. I try to respond to everything I see. And also be sure to subscribe if you're catching this on YouTube so you can catch all of our great videos. I post at least weekly, sometimes more than that, everything related to knee replacement surgery, preparation, recovery afterwards, frequently asked questions, all sorts of things. Thank you very much for watching, everyone, and take care.